Welcome to the WOVA Circle, real talk on fertility, wellness, and trying to conceive. I'm Gabie Peytchev, founder of WOVA Health and fertility educator. This podcast is your community space for navigating the path to parenthood with evidence-based insights, authentic conversations, and genuine support. I'm dedicated to being here with you through every part of your journey. One of the most shocking things about sleep and fertility is how quietly and profoundly poor sleep can sabotage your reproductive health. For women, even moderate sleep disruption can double the risk of infertility, disrupt hormones, trigger irregular periods, and increase the risk of early pregnancy loss. For men, poor sleep is linked to lower testosterone, reduced sperm motility, and can even damage reproductive cells directly. Yet, sleep is rarely discussed in OB/GYN offices or fertility clinics, despite its powerful impact on fertility outcomes. That's why I'm excited to have Dr. Samanta with us today. She's a board certified ear, nose, throat, and sleep medicine specialist with over 18 years of experience helping patients transform their sleep health. She's also part of the WOVA Expert Network, where she supports individuals and couples as a sleep coach, working on sleep quality while they're trying to conceive. And she's a member of the World Association of Sleep Medicine and the European Sleep Research Society. Dr. Samantha, there's so much people don't know about how sleep actually affects fertility. What are some of the biggest sleep issues affecting fertility? And why don't people hear about this more often?
So thank you very much, Gabrielle, for this invitation. It's a pleasure to be here with you talking about sleep. We all sleep, right? So we should be talking more about sleep in any circumstance, but particularly talking about fertility, it has a huge impact in our ability to conceive. And as you said, we barely talk about it. Right? We talk about nutrition, we talk about exercise, we talk about mental health, but we don't talk about something that we all do and that takes around a third of our day. Right? So this is, let's say, I can give an overview because for sure we'll talk more in depth about some of these aspects. But sleep is related to pretty much any function in our body. Right? So sleep is related to mental health in a way that we process emotions. And we know the impact of mental health has infertility, right? It's very well known that when a couple, for example, cannot conceive, they adopt a kid, they reduce the pressure to get pregnant, and then they get pregnant. This is, let's say, this is how much our emotions impact our fertility. And in sleep is very, let's say, the role of sleep in emotional processing is very clear today, right? We have a better processing of positive emotions. So this is just, let's say, one aspect to begin with. Then we have our body. We have hormone production, for example, hormonal production. Pretty much all hormones that we produce have a circadian rhythm. That means that they have one moment of the day that it will have, let's say, a peak or a nadir that we call that is the lowest level of that hormone. And that usually correlates with our circadian rhythm, sometimes even with sleep stages, right? So if we're talking about fertility, we have to talk about sexual hormones. If we talk about sexual hormones, we talk about sleep. That is very clear in science today. Then we can also talk about our metabolism because sleep is important for us to control our blood sugar, for example. Our appetite as well has a very strong correlation with the amount of sleep that we get at night. So if we are talking about having a very healthy body to be pregnant, to have a baby, we need to talk about metabolism or glycemic index, for example, right? The sugar levels, we have to be very adjusted And sleep plays a big role in this. Let's say in these three dimensions, we can already see how much sleep is fundamental for you to have good success in a fertility treatment.
Very interesting. Like you said, sleep is one of those fundamental things. Basically, sleeping, eating, pooping, peeing, breathing, these are so fundamental that we actually take them for granted most of the times.
Yeah.
But your brain always picks survival. So if you're not sleeping well, or if you're eating poorly, if your bowel movements are not doing well, then your brain is going to pick survival over reproduction. So that's why it's so important, even though we don't think about it as important, it is. It's very important for
Yeah.
everyone, including people who are trying to conceive.
Exactly. And another thing that, let's say, I remember now, because we could go on with this list forever, is our sexual drive, right? Because as you mentioned, when our body is not working well, our body will tend to preserve some minimal functions for our preservation, the basic survival. And of course, fertility is not going to be a goal, will not be a fundamental task of our body. So there's something similar to it with our sexual drive, right? When we are not well rested, fed, we're not exercising well, we are not going to be interested in a sexual encounter. And this is also important for fertility because it's a treatment, but sexual health is also so important for us.
100%. Yes. So you mentioned about hormones, and I just remembered that I've read multiple times that it's very important to go to bed by 10 p.m., 10:30 at night.
So this is, let's say, a misconception that we have because we have what we call chronotypes. We don't have to go to bed at the same time because everyone is a bit different. Right? So I'll give my example for us to make it a little bit more concrete. I am what we call a morning chronotype. That is, I prefer to go to bed early and I wake up early. Right? If I can do that, I am working just fine. I'm very productive. Right? My bedtime is around 10 p.m. and my wake up time, the ideal, is around 6 a.m. Right? So if I can do that, I am, let's say, in the best mood, best energy level throughout the day. I am much more, let's say, active, let's say, mentally and physically in the morning. So I concentrate the most important tests in the morning. So let's say I'm now studying for a new test. So I do this early on, right?
Mhm.
And then my energy starts to drop in the afternoon. And if I have something important to do at 8 p.m., my brain is already shutting off. I'm already almost turning off to go to bed. This is a morning type. There are people who are the evening type, right, that like to go to bed, who like to go to bed late and wake up late. These people, as they describe in my office, right, they are, if you wake them up early, their brain isn't processing things yet. They still need some time to be ready. They take some coffee, they wait because their brain needs to wake up, but the brain is not functioning well. But in the late afternoon, sometimes it's when they are most active. That's when they are creative. If they have to do any kind of creative or cognitive work, they are the best. So this is the evening type. And we have another type that is the intermediate type. That is, this would be someone who can adapt a little bit better between morning or evening time, right? They can adjust better. They are usually a little bit less susceptible to sleep deprivation because, let's say, if they need to go to bed a little bit later because of work or study, they can adjust a little bit better, right? And these chronotypes are partially genetically determined. So we have some genetic load and we also have some environmental load, right? So let me give you another example. I am in Spain, and in Spain people do things late. right? So they don't wake up too early. They like to have dinner late, right? So having dinner at 7 p.m. for a Spanish person is way too early. So I tend to adjust when I am in Spain. I tend to adjust my activities to a little bit later, right? So I usually go to bed around 11, 12, and then I wake up around 7, 8. So it's a little bit later, right? So even though I'm a morning type, I can also adjust a bit. We have some flexibility. But a morning type will never be an evening type, and an evening type will never be a morning type. And so someone who likes to go to bed late and wake up late, they will not be productive waking up at 6 or 7, right? No matter what they do, because there's some limit to our genetics, right? We have some limits in our body. So saying that someone should go to bed at 10 p.m. is for more for the morning types. And for the evening types, we would be a little bit later. So they will produce, let's say, they will have a perfect hormonal production, but at their time.
Got it. Huh, interesting. Yeah. Okay, so the 10 p.m. cutoff for bedtime is really a misconception. It's very individual, is what you're saying.
Yes. One another way that I usually explain to my patients is the equivalent to the phototype. The phototype is the color of our skin, right? And it refers to how likely we are to get sunburned, for example, or to get a tan. For example, I'm phototype 1 and you might be too. So we very rarely get a tan, right? For you to get a tan, to get some color during the summer, you have to expose yourself to the sun for several weeks. And there's a very high probability that you get some sunburn, right?
Yes.
And no matter what you do, you can go to the coast and try to get some sun every day. This is your phototype, right? You will not change this. Someone with a darker skin can go to the sun, can get some tan much easier. And we already understand this. So it's the same concept for chronotype. We have some variability, some things that we can change. I can get a little bit of color during the summer, but I have to go to the beach, let's say several days or weeks before someone who has a darker skin color. So you can adjust, but just for a little bit. And that's how we should see sleep, right? In sleep, we don't have the same awareness that we have for skin color, for example.
Okay, I have so many questions. Just one last question before we move to sleep apnea. So, evolutionary speaking, if you go back in the days when we only relied on natural light, maybe the candle, and we didn't have the artificial lighting, and then you have also the different skin tones and people living in different parts of the world where somewhere it's getting dark earlier in the day versus later in the day. So is that also impacting of who is like a morning person versus an evening person?
So you're right. Let's say your view of it is perfect. This comes from evolution because when we were living in tribes, we had to have someone awake to be vigilant, to be alert for risks. This is very well documented even in what we call pre-industrial societies that we still have today. We have a few pre-industrial societies, let's say groups of people who live in a place where you don't have technology, and so you don't have the influence of the industrial revolution, right? This is where we study most of evolution around sleep, and this is very clear. This was, let's say, a safety that we had at that time. Just like other species have something different, right? For example, ducks, you know how ducks sleep? They sleep in a row, and the ducks who are in either of the extremes, their brain will sleep just half of the brain, right? So that one of the hemispheres is always keeping an eye on the outside. And then after some time, they will change, right, their bodies so that the other brain hemisphere can sleep. And this is an adaptation that the ducks had to preserve their species just like we humans had our own.
I can't wait to talk about this more and more, but let's move to a topic that's very personal to me, and let's talk about sleep apnea. When my husband and I were trying to conceive, what I've noticed over the years while we're together, that he would always be exhausted. He would oftentimes nap late in the day. Sometimes he'll sleep for 8 hours. Sometimes he'll sleep for 12, 13 hours in a day. He could nap at 5 p.m. and then he could go to sleep at 9. And I've always wondered, like, why is he never rested? What's going on? He also had some weight, blood pressure, and cholesterol issues. At the time, we didn't connect the dots. But at some point, I started suspecting that maybe he has sleep apnea because of his fatigue and because of not being able to rest. I encouraged him to get tested, and we went through the process together, and he was diagnosed with severe sleep apnea. So he began using the CPAP machine at night, the one that you only basically put on your nose. I know there's different devices you can do for sleep apnea depending on how severe it is, and we can talk about this. But looking back, I believe untreated sleep apnea was one of those major missing pieces in our fertility journey. In the US, for example, about 11% of women and 22% of men of reproductive age have obstructive sleep apnea, but many of the cases go undiagnosed. Over 90% of women and over 80% of men with moderate to severe sleep apnea are unaware and untreated. So that's why in today's episode, I'd like to focus on sleep apnea because it's a big topic. And a lot of people might think, oh, I don't have it. But if you look closer, you might actually have sleep apnea. And there's ways to treat this, to manage this. And that is definitely affecting your chances of conception. So, first, what is sleep apnea?
Yeah. So you touched, Gabrielle, in one of the most common sleep disorders. It's the second most common sleep disorder after insomnia. Sleep apnea is a very important issue. And the definition of sleep apnea is that when the muscles of our throat, so let's say, let me go back a little bit. We have in our throat some muscles that will protect the airway, so they will block the airway that we call constrictors in our throat, and we have some muscles that open the airway, right? That we call dilators. So when do we need to close our airway? When there is the possibility of something going into our lungs. So, for example, when we eat something or drink something, this is not going to go to our lungs. This is going to go to our stomach, right? So these muscles act to preserve our airway. When we are coughing is a reflex that will also close the airway, right? For anything that is in the upper airway in our nose, for example, don't not go to our lungs, right? So these are, let's say, they protect us, right? And we also have the dilators that are responsible for getting us the air, right, to our lungs. So this is how it works. And sleep apnea happens because we have an imbalance between these two forces, right? And the muscles that close the airway, the constrictors, win. That's how we can explain in the physiological part of it, right? And what causes it to happen, right? What causes sleep apnea? There are many things that are involved. We know today it's a disease that is very complex because there are many causes to it. One of them is genetic, right? So if your parents had sleep apnea, there's a bigger chance that you might have it too. There are environmental and things related to habits. So obesity is one of the most common causes of sleep apnea, for the reason that overweight and obesity will increase the fat tissue around the muscles, right? So you will basically have a shorter and a tighter airway. And these muscles will not work really well because we can even see this in MRIs that these muscles are infiltrated by fat, so they're not working properly. And I wanted to mention obesity because we know that this is, let's say, the number one factor that we can intervene, right? That we can be proactive in dealing with. And that's why, let's say, obesity is why we are having such of a epidemic of sleep apnea today, right? We also have people who have, let's say, a different anatomy in their face. They will have, for example, a mandibula that is retroposition, right? So it means that this bone, the mandibula, is positioned in a way that your throat and the back of your tongue will have less space for the air to pass, right? So we also have, let's say, anatomical issues related to our bones, to the structure of our face, but we also have anatomical issues that are related to soft tissues, like amygdala, for example, tonsils, right? So when you have very large tonsils, they can make your airway tighter, right? This is something else that we can work on. For example, we have surgical treatments for this, right? So these are, let's say, the main causes that we have for sleep apnea that explain why we're having such big numbers in terms of prevalence that you mentioned. Yeah.
And you did talk about the jaw and the structure of the jaw, and that reminds me, I was reading a book, Breath, very interesting. Again, talking about evolutionary, how our jaw has changed over time because of the food we're eating. That nowadays the food we eat is more processed, it's much softer, so we don't exercise the jaw as much as we should be exercising the jaw, and then the whole structure of the face is changing, and our airways are becoming more narrow.
Yes, that's true. I mentioned mandibula, but this is, let's say, as a medical term, it's the jaw. That is correct. We've been seeing changes in our bone structure of the face that has happened. And that is correct. We're eating much more processed food. That is also not good for our gut. Gut health also has to do with sleep. So there are many things that we should consider going back to eating more raw and less processed food. And it also has to do with sleep apnea, right? Because the more raw, unprocessed food you eat, you tend to lose weight. And any weight that you lose will have an impact in your sleep apnea, right? Or your apnea index.
Yep, and I guess the more you exercise the jaw, probably that's gonna impact also how narrow or wide your airways are. So there's a lot of things you can do to do all of these changes to help you with sleep apnea.
Yes, absolutely. So there are specific treatments for many of these causes that we mentioned. Some are what we call mandibular advancement devices. So these are usually devices that the odontologist will help customize that will bring forward your jaw, therefore not letting the base of your tongue collapse at night. So opening your airway, this is one of the treatments that we have for this.
What happens hormonally when a man has untreated sleep apnea? Thinking about testosterone, cortisol spikes, insulin resistance.
Yeah, there's a very important link today between sleep apnea and several diseases and dysfunctions. So, when we have this collapse of the muscles in our throat that I mentioned, what happens is that we start losing our oxygenation. So, our levels of oxygen in our blood, our tissues starts to drop to a point where our brain will wake us up to breathe. Right? And sometimes this cannot be, let's say, very well perceived. Sometimes these are micro awakenings, but they are happening. Right? So it means that our sleep is not stable. Right? It means that in sleep apnea, we're not going through, let's say, the normal sleep architecture between the phases, non-REM and REM. We are constantly waking up in these phases. So when we even look at polysomnography of someone who's having sleep apneas, we see a lot of intrusions in their brain activity because this person is being woken up several times at night because of the sleep apnea, right? Because the body tells the brain that it needs to breathe, right? Then we wake up, the airway opens, and then we go back to sleep, the problem comes back again. So the main issue of sleep apnea with sleep is that it causes the sleep to be very extremely fragmented. Right? So we lose a lot of the deep sleep phases because we don't let our brain go to the deep sleep phases. So one thing that is very common is for us to see the percentage of the deep sleep phases and REM sleep that is also deep or smaller in these patients, right? So they have a more superficial sleep. And this causes several problems to our hormonal production because many of the hormones that we have are linked to a specific sleep phase. Right? So if you lose the, let's say, the normal architecture, the normal cycles of sleep, you're going to make a mess, let's put it this way, with your hormones. Right? So many of the times, what you will have is a decrease of these hormones, right? Of the sexual hormones. And this decrease, this impact in hormonal production can be a little bit different if it's, let's say, an acute issue or a more chronic issue, right? When you're talking about sleep apnea, that is a chronic issue. Many people have this for years, sometimes decades before they even come to the doctor, right? So it's a chronic sleep deprivation that they're going through, right? They're chronically fragmented with their sleep. So what this usually does is a decrease in all sexual hormonal production. Right? So when someone with sleep apnea that is not being treated go to see a fertility doctor and they will ask some hormonal tests, right? Laboratory tests, they will most likely see lower than the normal levels. And that's the main issue that we need to look at this in the context of sleep apnea and not try to replace these hormones, but to address the cause, right? And that's, let's say, the big issue that we have today that many times we don't talk about sleep and we don't investigate sleep in the context of a fertility clinic.
So would you
You
say,
have seen this experience yourself, right?
yes? And I was the one who diagnosed it first, actually, because I was noticing this over the years. And I was reading about it and trying to figure out before we even went to the doctor. If it wasn't for me, my husband probably would go on for this for years and years. And he talked to his friends. A lot of our friends also experienced similar symptoms. And he told them, I sleep so much better with a CPAP machine. He's been encouraging them to go to the doctor. And unfortunately, a lot of people don't. They're still being so resistant about it because maybe because they're so used to it, even though it's completely changing their quality of life. If you don't feel rested, that affects also what you eat. You're craving more sugar. Your cortisol levels are all over the place. All of your hormones basically are going to be a complete mess, but you're probably so used to this. Do you see a lot of resistance? Do you think that's why a lot of people don't get diagnosed and treated?
Yes. So when we talk about a sleep doctor, we have different backgrounds, right? We have different specialties. And I am an ENT, I'm a nose and throat doctor. So usually when a patient comes to me, it is because they are looking for surgical alternatives to CPAP, for example, right? And I see a lot of resistance to CPAP, mainly because of misinformation, right? Because today the CPAP machines are very compact. Most of them don't produce any noise, so very quiet. Many of them have their travel version for you to take around. So the CPAP technology has evolved a lot. And we also have a lot more treatments that are not related to CPAP. Surgical procedures have evolved a lot. We have some procedures to correct the anatomy, like I mentioned, big tonsils, but also we have some, let's say, plastic surgery of these muscles that is called pharyngoplasty. We also have devices that can be implanted that will work on giving a stimulation to the correct muscles that I mentioned, to the muscles that open the airway. So today we have many other options, right? Not just CPAP that it has also evolved, but other options that we can offer. And I think that we don't talk much about this several options as we should, because it would reduce this barrier, this resistance that people have to go see a doctor. Right?
Yeah, and in the movies, when you see someone with a CPAP machine, it's one of those old, huge machines. And I think that's also where that fear factor, resistant factor comes in. But like you said, there's so many options. You can even go to the dentist. Sometimes they can also give you a specific device if it's not a very severe sleep apnea. There's so many ways to correct this.
That's it. So for a mild sleep apnea, the mandibular advancement device, that is something that the dentist will customize. As you mentioned, it's just a device that you use at night. It will bring forward your jaw. And this is one of the treatments. We recommend, let's say, if you have a suspicion, to go to see a doctor to do a sleep test, and then they will mention if it's a mild, maybe the advancement could be something. I guess the most important thing is for people to be aware of it and start investigating. Right?
How does sleep apnea affect sperm production and sperm quality?
When you have a fragmented sleep, and let's say we say something that is called apnea hypopnea index, that is the amount of times per hour that you have an apnea, that is an episode of closing completely, blocking completely your airway, or hypopnea, that is not a complete closure but will disrupt your sleep. So if you think about someone who has an index of 20, right? So it means that this person is having 20 of these events per hour, right? So this is a completely fragmented sleep. This person's not sleeping well, right? And sometimes we see apnea hypopnea indexes as high as 100. Right? So this person is definitely not sleeping. So when you're in this level of sleep apnea, your body is not thinking about reproduction. Right? So your sperm count will drop, that is for sure. And your sexual drive will also be certainly reduced, because your brain and your body are trying to optimize for survival. And sperm production is definitely not going to be a priority.
Can treating sleep apnea reverse or improve testosterone and sperm quality?
Yes, they can. Yes, they can. There are few articles on reversing this and increasing sperm production. But yes, let's say when we treat sleep apnea, it will take some time for the person to, let's say, optimize their blood pressure levels and the hormone production. It's not like it's overnight, but in a few weeks, you will probably have this restored, right? Especially if it's, let's say, combined with other treatments. For example, someone who has obesity or overweight or obese and also has sleep apnea. When you start treating sleep apnea and you go through a weight loss program, then you would expect a huge impact, right? A huge positive impact in your sperm count and in your hormone production, in your energy levels, right?
Yeah, and I can confirm that based on our experience too, because when we found out, so that our first IVF failed, we found out about sleep apnea. He started using the CPAP, but my husband also started working out. He started preparing for a marathon. He lost weight. He started looking at his nutrition. He stopped drinking alcohol altogether. And I think all of this had a really positive impact. We did have success with the next round. So it could be, that could be actually one of the big reasons why. So yeah, I can confirm that you can see results within just a few weeks.
How long did it take for him to get, let's say, better quality of sleep and feel more energy?
So we didn't retest for sleep to see how he was sleeping, but he was monitoring it himself. He definitely saw an improvement, not just with his sleep, but overall after he lost weight, his quality of life improved. I think it took about maybe 2 to 3 months.
It's a very reasonable time frame.
As you can imagine, with a lot of people, it's very hard to stay consistent. So it's been going on and off. So he's still using the CPAP machine and he likes it so much that I think even if his sleep improves, he's still probably going to continue to use it just because he's seen that huge difference between before and now. And he carries it everywhere. It really improved his sleep.
When you have been prescribed the correct treatment for your case, for sleep apnea, the first few nights you're usually so sleep deprived because you were sleeping and sometimes sleeping more hours. Like you mentioned that your husband was sleeping sometimes even 10 hours, correct me if I'm wrong. This is the body trying to compensate for the bad quality. He, in the end, was sleep deprived. Even though he was sleeping several hours, the quality of the sleep was not good. So the first few nights of the treatment, be it CPAP or surgery or another type of treatment, you already start to see the improvements. And this, let's say, the first few nights, the experience that you have is crucial for the success because you have such a positive impression and results the next day. This is the most important factor linked to adherence to the treatment. Keep using it. So I'm very glad that he had this very positive experience because this is what keeps him going.
Yes. So you talked about how important it is for people to be aware that sleep apnea exists, that it's oftentimes undiagnosed, and they need to look for the symptoms to see if they might have it. So what are the common symptoms?
So this is someone who wakes up always tired, regardless of the amount of hours that they sleep. Sometimes they can wake up feeling some headache, right? This is also very common, and many times with a dry mouth, right? Because they end up mouth breathing almost all the night. So they wake up with a dry mouth, with a headache, and feeling that their sleep was not restorative. And they will also have a higher likelihood of being somnolent or being sleepy during the day. In the severity of the sleep apnea is also related to the severity of the sleepiness during the day, usually. Not to say that for everyone, but most of the times. So this will also mean that this person is more likely to have an accident, for example, right? Or they will feel that they're not productive, that they cannot remember things very well because memory is also related to good sleep, right? So you will have, let's say, your cognitive skills are not the best. Right? And at night, this is someone who will have snoring, right? So 100% of the patients who have sleep apnea have some degree of snoring. It can be very high, but not necessarily, right? Let's say how much you snore or how loud you snore does not have a linear correlation with your sleep apnea severity. But you are snoring at night, and your partner might, not to say that all the cases, but very commonly, the partner will mention that you wake up suffocated, right? You wake up many times per night, you have a very agitated sleep, and you have this suffocating experiences at night. Some patients even mention this, right? That they wake up feeling suffocated, right? And many of the times this is an overweight or obese patient. Not to say that skinny people will not have sleep apnea. There is a phenotype that we call linked to more skinny people. So not only overweight, but many of the times it is an overweight or obese patient.
Can you have sleep apnea if you don't snore?
I would not say so because snoring is a hallmark. The person might not know that they snore, right? So if you don't have a partner or anyone else, you might not know that you snore, but it's very unlikely for you not to snore, right?
And do you see different symptoms between men and women? Because women, even though usually men have more cases of sleep apnea, is what I've read, there is a high prevalence in women as well.
Let's say the symptoms can change a bit. Many times women will have, let's say, humor issues, tendency to have, let's say, a worse mood when it comes to sleep apnea. But they both will have, let's say, a cognitive impairment, what we call, right? So the memory, your cognitive abilities to understand something will be compromised, right? But many times we see that mood issues can also be something around women, right? They will feel more irritated. Kids have this too.
Yes, so let's move to kids. My kid is 2.5 years old. I do actually think she might have sleep apnea. So she snores a little, not as much, mostly when she's sick. But I've noticed because she oftentimes sleeps on top of me on my chest, I noticed she has breathing pauses. And oftentimes they're when she's sick, but sometimes even when she's not sick. And we're going to do a sleep study soon with our hospital to find out. I hope I'm wrong, but maybe you can talk about that a little bit too. Sleep apnea among children, how common it is, and what symptoms you see there.
Yes, so sleep apnea can happen in kids too. And in kids, it's a bit different from adults. And when we talk about kids, I'm mentioning, let's say, kids with a normal neurological development, right? I'm not talking about kids who have some neurological disease, for example, right? But let's say kids who are growing, you know, having a normal brain development. When they have sleep apnea, this is usually, let's say, almost all cases are related to tonsils, right? The hypertrophy. So you have a big tonsils that will block the airway in kids, right? And kids will, different than adults that will have, let's say, will usually be more tired and sleepy during the day. This is very common for adults. In kids, it will be a little bit more of the opposite. Sometimes these kids will be extremely alert, extremely active, and irritated. Right? So these are kids who they don't usually have um, any need to sleep during the day. They're not as tired as adults. Many patients who have sleep apnea will take a nap, for example, during the day because they're feeling tired, or sometimes they will have accidents, as I mentioned, as a result of this sleepiness and micro sleep that we called. Kids are exactly the opposite. Kids are extremely active when they have sleep apnea. And this is one thing that we discuss a lot with pediatricians because you can also have a differential diagnosis with ADHD, for example, right? Any kid who is undergoing a medical evaluation for ADHD should be evaluated for their sleep, right? We should check if they're sleeping properly, they're sleeping at, let's say, an appropriate time for a kid, and we should rule out sleep apnea because the day to day, how these kids work during the day is very similar, right? So they're very irritated, moody, and extremely active.
Okay. Okay. We checked for tonsils. They're not enlarged. Also, she is not having any weight issues, but sleep has always been a problem for us, and she stopped napping early on. So I do see some of the signs. They're trying to, yeah, hopefully with the sleep study, we'll find out if that's even happening. She's definitely developing well, and yeah, we'll see what's going on.
Let's say, apart from the tonsils that are structures that we can very easily see at the back of our mouth, we also have another structure that is part of the lymphoid tissues that are the adenoids, right? The adenoids, they are at the back of our nose. And we can only see them with a small camera, so a small endoscope that we introduce in our nose, or with an image exam. So in kids, we will look at the tonsils and the adenoids, because if any of them is bigger, is hypertrophied, we can have a blockage in the air passage.
So going back to female fertility, how does sleep apnea disrupt female fertility? Does it have to do anything with like ovulation or progesterone or insulin resistance, inflammation in the body?
So all of that all together, because sleep will compromise, let's say, poor sleep quality will compromise pretty much all of hormonal production. And this will include the sexual hormones. This will include hormones that are linked to our metabolism. This will include hormones like the thyroid hormone, right? And all of them have an impact in fertility, right? So when you have poor sleep quality for any reason, and we're talking about sleep apnea, but it could be just insufficient sleep, right? Which is, let's say, the most prevalent issue around sleep today is insufficient sleep. So a person does not sleep the amount of hours that she should because of work, study, etc. Let's say the modern society problem. So when you have a sleep quality issue, such as sleep apnea, you sleep but you don't sleep well, or you have an insufficient number of hours, you're going to impact your hormonal production, and this will impact your fertility treatment. It can imbalance your ovulation, can produce less eggs, for example, if you're inducing a treatment. It can have several issues, and it can also impact your metabolism, increasing what we call the glucose tolerance. So your body doesn't manage well the sugar that you eat from your diet. And you can also be hungrier. So when you don't sleep well, you tend to feel hungrier, right? And you will have a tendency to process food, to fatty food. So you will not only want to eat more, you will want to eat more of processed food, of sugary food. So this in combination, let's say a bad metabolism with a bad sexual hormonal production, is definitely not a good thing for someone who is undergoing a fertility treatment. It will not be as successful as it could.
Yeah, like you mentioned, if you don't have good quality of sleep or enough hours in the night, your insulin resistance goes up. And then why are you craving all these sugary processed foods? You don't have enough energy because you're not rested. And what's the quickest way to make up for this lack of energy? Carbs, simple carbs. So you go for all the bad foods and they also interfere with your fertility. So briefly, can we talk about how sleep apnea is affecting early pregnancy? Does it have to do anything with implantation, with miscarriage risk?
Yes, and also metabolism during pregnancy, right? Because another thing that we talk more and more today is how is our metabolism, for example, sugar metabolism during pregnancy, and how this can impact not the pregnancy alone, but the health of this kid, right? So when you have, for example, a pregnant woman who's had the diagnosis of gestational diabetes, right? So diabetes through pregnancy, this kid will be more, have a higher likelihood of having diabetes, right, over his or her life. So this does not only impact pregnancy, it also impacts the babies and then later adult life, right? Yeah, so poor quality of sleep, let's define it like this, will make your pregnancy, let's say, less likely, will put more risk into your treatment. This can happen early on in the pregnancy. This can happen later. It depends on many circumstances. It also depends on the severity of your sleep apnea, right? Because let's say when we talk about severe sleep apnea, that is someone who has very fragmented sleep, because as we mentioned, you have episodes of sleep apnea that are happening so many times per hour that you barely sleep. So this is someone who will usually snore a lot, and someone who will complain at some point, right? They know that their sleep is not good. They are very sleepy. So this is the type of person who will most likely come to us, right? Or faster. But the mild and the moderate sometimes are hard for us to catch and for the patient to start seeing some signals. And what can happen during pregnancy, not early on, but usually around the second and the third trimester, is that you gain weight because you're pregnant, but sometimes you will also compensate with food. So let's say if you don't have a good diet, you don't have a good nutritional support in the first few months of pregnancy, you will gain more weight than you should. And this can also cause sleep apnea for the issue of increasing fat tissue around your throat. So you can also, there can also be the case that you did not have sleep apnea before pregnancy, and you end up having sleep apnea during pregnancy because of weight gain and also a bit of the liquid retention, but it's mainly because of weight gain.
Is there something you can do about it then during pregnancy?
Let's say nutrition is one important thing, right? If you're overweight and obese, have a treatment, be guided by a nutritionist 100% in all the cases, and have a sleep test, right? Because you need to have a diagnosis. And if that is the case, let's say for a moderate or severe sleep apnea, it would be a CPAP machine, right? It can even be considered as a surgery. Let's say you have a blockage in your airway that could be treated by a surgery, but we will not do this during pregnancy, right? Unless it's, let's say, something very remarkable. But most of the times it will be a CPAP machine that can bring you back sleep during pregnancy for you to go through it, let's say, in a safer way, being treated. And then after pregnancy, this can be reconsidered. Right?
So you talked about gestational diabetes and sleep apnea. This is basically diabetes that you unlock during pregnancy.
Yes.
How are these two connected? Can you talk about this a little more?
Yes. So gestational diabetes is a diagnosis that you give during pregnancy, because we know that pregnancy will put the woman's body to the test. And if you have any degree of glucose intolerance or diabetes previous to pregnancy, it will tend to get worse during pregnancy. But even if you didn't have this diagnosis before, you will be more likely to have some kind of glucose intolerance during pregnancy, because that's a state that puts our body to the limit, let's say. And sleep apnea can make this worse, right? Because sleep apnea, fragmenting sleep, we don't produce the adequate hormones that are linked to appetite and metabolism, right? So I can mention two very important hormones in this sense that are called leptin and ghrelin. So leptin is a hormone that our fat cells produce that makes us feel full, that we don't we're, we had enough food, right? Ghrelin, on the other side, is a hormone that our cells in our stomach produce that signal to our body that we need food, that we are hungry, right? And these hormones contrabalance, right? So all of this is connected. When we have good sleep, we have a good balance of these hormones, right? In fact, we have higher levels of leptin when we have good sleep, right? And we have lower levels of ghrelin. When we don't sleep well, so let's say we have sleep apnea, untreated sleep apnea, we will have higher levels of ghrelin. which means we are hungrier during the day. And not only we want to eat more, we also want to eat more of bad food, right? Bad quality food. So we are more likely to want a pizza or burger or sugary food than it, as opposed to having a good night of sleep. We will have our appetite much more controlled. So this is just one of the ways, and this is one very important way in which our sleep controls our appetite and our metabolism. So if we don't have this well controlled, let's say, for example, during pregnancy, a pregnant woman has sleep apnea and is underdiagnosed, she will more likely eat a lot more and bad quality food, which is something we certainly don't want to see during pregnancy.
Perfect. Thank you. Thank you so much. So just to summarize a good takeaway from this episode. So look for symptoms. If you're in a partnership, ask your partner also to watch for symptoms. And some of the symptoms we talk about, snoring could be very loud or not so loud. How many times a night do you wake up? Do you need to go to the bathroom all the time? Or do you need to drink water? Do you have dry mouth? Do you have those breathing pauses? Do you crave sugary foods during the day? Do you feel rested? So these are some of the common symptoms we discussed. Look out for those, get tested, talk to a professional, get a nutritionist on board. There's a lot of people that can help you manage this so you can improve your quality of life and you can improve your chances of conception as well as
You're
your pregnancy and the health of your children.
exactly. This extends to the whole life of your kid, right? And you summarize it perfectly, Gabriel.
Thank you, Dr. Samanta. That was very interesting.
You're welcome, Gabriel. Sleep is so important, and I believe that we need to talk more about these issues. And I thank you for this opportunity.
Of course.